ChatGPT and GenAI tools have hit the mainstream. The chatter was everywhere, by almost everyone. We feel the discussion has been more philosophical than practical. We know enterprise technologists are using real AI to create efficiencies that result in real business outcomes. So, we created a show to talk to real practitioners about real-world active projects that are leveraging this exciting new technical advantage. Welcome to LiveAI.
Welcome to another episode of LiveAI, where we bring real enterprise AI use cases to the people. With me today, I have Jason Peoples, Director of Technology and Innovation at Mary Free Bed Rehabilitation Hospital. Welcome to the show, Jason.
Thank you very much, Tony. Good to be here.
And what AI use case do you have for us today that we're going to talk about?
So we have a lot of AI initiatives that we're really looking at. Mary Free Bed, we're a rehabilitation hospital. We're in West Michigan, so we're not the center of the universe, but we have a lot of patients that come to us from all regions. So not only from Michigan, but across state lines as well. So the patient populations, that we serve are medically complex. So documentation is really, really important. We know that in a patient's medical record, if you didn't document it, it didn't really happen. So when we hear about time spent from our physicians, our providers, our clinicians, could be a nurse, could be a therapist, they're spending a lot of time documenting. So when we think about the time spent away from patient care, we talk about the time spent really doing that documentation to meet the regulatory, the reimbursement requirements, making sure that we marry minimal documentation with good documentation. So when the patients come to us for their injuries, when they go back to their home communities, their primary care providers, whomever that is, that we marry that good documentation with something that would be something digestible by those referring providers, again, when they go back to their communities. So we've really taken an effort to figure out, all right, how do we do this effectively and efficiently? So we've got a number of initiatives underway, but really has been exciting to leverage some of these emerging techs. Some of them have been here for a while, but some of them have been really refined over the last few years. And I think we can thank, the advent of ChatGPT really pushing generative AI in the mainstream. So we've got a particular use case that we're really focused on right now. It's more of a pilot that we have been working on with one of our clinic providers with scalability in mind, of course. So that's why we wanted to start with the pilot. Start small, build on the success. So in this case, we're working with an ambient AI solution that a provider is using on a mobile device that is able to really capture with what's happening in the moment with those patients and provide dictation in real time in a progress note in the medical record. So provider is being able to treat patients, interact with the patients, and then being able to essentially document in real time with those patients. So it's a huge time saver. There's also the ability to be transparent with what's being said and interacted with that patient that goes into the medical record. So that's a huge time saver. And we look at that, starting small, building on the success, where we have other clinic providers that are really, really excited about the idea. We want to make sure that this is safe and effective and provides that level of documentation that's consistent with the regulatory and the reimbursement requirements.
So you are deploying a solution where if I'm a physician, I walk into a room and I have a patient there. When you say ambient, it means that you're detecting any audio in the room, and then you're turning that into a script that you're capturing so that can go into medical records. Did I get that part right?
Yep, exactly.
And then can the physician and the patient see what's being recorded in real time, or this is something that for your use after the fact?
I think that'll be something that could come later. With the device that we're using now, it's really just a handheld mobile device, nothing different than an app on your smartphone. So there is the ability to have a larger video display, like in a clinic room, that would actually show with what that dictation would be that would be populating into the medical record.
Yeah, I'm really passionate about the space because, healthcare is something near and dear to my heart. I really feel like technology is going to solve so many problems in the way that we think about clinical use cases. In this use case, we're looking at how are we saving time and getting more efficient with the use of physician time. But this is one of those spaces where there's, many brave technologists out there trying to make a difference, and really excited to dive more into this today with you on what you're doing. And I know you've got other ideas on how you guys believe the future will look and how you're going to apply AI. And we'll get into that here in a little bit. Digging back into the solution, and maybe for the sake of our audience, because I'm not sure everyone else is aware of how big this problem is, When you think about the administrative load on physicians and nurses, could you describe a little bit around what that problem looks like today and why what you're doing with even, ambient recording of scripting and putting that back into patient records can have such an impact?
Yeah, so every time that we think about new regulatory compliance considerations, a lot of that requires more documentation or something that would be a checkbox in the medical record to satisfy with what that is. So the medical record is really tied in exclusively into these workflows. So we've done really well with trying to minimize the amount of communications, especially clinical communications that live outside of the medical record. I mean, we're at the age of we want what we want and we want it right now. So that age of instant gratification is here. And my challenge is embracing that reality. And how do you put that in a practical use case that's actually useful for the teams that are using these solutions and these pain points that they have? So my goal is to listen to what those pain points are and really look at ways that we can match the technology to meet with what the needs are. So kind of the mantra that I take with all the things with IT and healthcare is I don't view our teams as an IT department in healthcare. We're really healthcare IT. None of us would be here if it wasn't for the people, the patients that we serve in the communities. So when I hear stories from our help desk and some of our other team members, really driving that back to the why we're here. None of us would be here if it wasn't for the patients. So really embodying that methodology into with what we do to provide solutions to the organization. I want to make sure that we have a seat at the table. We're able to listen to what the needs are and then explore options to meet with what those pain points. So we talk about the documentation, thinking about it from a hospital perspective where we have, there's a nurse shortage across the country. We're also seeing shortages of radiologists. We're seeing shortages of therapists. It's a really frustrating conundrum because people need care. So the more time that we can spend providing that direct patient care at the bedside, those interactions with the patient in a clinic setting or a therapy setting, that's time that we can spend with that patient, but we also need to document. So how do we work through that reality with the healthcare worker shortage? How do we minimize the documentation time? What tools are out there? So if providers are spending, more minutes than they should, let's say, or if I hear a story about, let's say, an outpatient therapist who's providing treatment to a patient and they're, going on some exercise activities, and here we are, stepping away from the patient. I'm over here on my laptop and I'm going to document. And there's a feeling with those clinicians. It's like, well, I don't feel like I'm putting enough information in here. So there's that fine line of the right amount of information, but there's also note bloat too. So we're trying to work through that reality too and say, okay, what do you have to have in here? And how do we make this really, really concise, really good without feeling like you're missing something? So some of that's with education, some of that's with standards, some of that is just with operational procedures, and really driving that change agent to be able to look at things a little bit differently, embrace that reality. How do we augment with what we're doing with the technology tools that we have today?
So when you think about this solution specifically, as you were entering in, here's a use case that we believe that we can make a difference, were you able to benchmark how much time is being spent today on documentation, the effectiveness of that documentation, and then what did you witness in the pilot? And did you have some kind of goal for improvement, or was this really more of an experimentation to see what you could do?
Well, you've got to start somewhere to get anywhere. And I think the hardest part to begin is to just begin. So in this case, we have we know what the documentation requirements are. We know different providers in this case they really run their practices pretty differently. So as much as we drive standardization, every provider wants to practice medicine their own way. So it takes a physician champion to help, drive these ideas, take that proof of concept and drive it to fruition. So we were really fortunate to have some very progressive physicians in our medical group that not only have an interest, but have a desire to tackle this and really champion with what the solutions are. So we look at with what existing data is today, how much time is being spent with this particular provider and how much time they're spending documenting away from patient care. So we look at that as a baseline metric, and then we would be able to say, okay, introducing another solution into the mix, how do we measure that? So how much time is spent documenting it? How much time is spent with patient care? So we know voice dictation, it's already out there. People have been using it for years and years and years. So how does that differ from an ambient solution? So being able to do that right there in real time, it's really at the physician discretion. So figuring out ways that we can embed this into as an extension of their clinical workflow, just as another tool in the tool belt. That is where we were able to really look at, the evolution of the technology, where early on in our pilot, we recognized that the technology was good, but it wasn't really great. And one of those elements as they're building out the learning modules for the machine learning, the artificial intelligence as the output was, there was a human kind of in the mix, making sure that they could transcribe that, feed the learning module, and then being able to say, okay, the documentation will post a little bit later. So it wasn't exactly in real time. To get that model sophisticated enough where it's more of a real-time output, it became a game changer for the providers that are using this today. So it's just another opportunity to say, all right, where you start is not going to be where you end up, but developing those parameters with a pilot with some of that scalability in mind, but also looking at how well is this working for you? What environment does this work well in? In a clinic environment where you've got a four-walled controlled environment, that's one area. You take that to a hospital room where it's a little bit different. So is this a one size fits all, or do we really look at the right solution for those use cases and then look at where else we could expand that to?
So Jason, if we were to peek under the covers a little bit, so give us a little bit of insight into what actually creates this solution, from the device to any software that you're using, any models you may have developed or other technologies. Could you just walk me through what that architecture looks like?
So with the technology that we have in our hands right now, we're using an ambient solution. It's really an app on a mobile device that our doc is using. They engage the mobile device, they're launching the app, they're recording, and there's an integration between that application and the medical record to drive that transcription right into the medical record, really in real time.
Okay, and then in the middle of all that somewhere, is that an application that you guys developed? Is that something that you customize off the shelf? Just walk me a little bit through, what technology pieces fit inside there.
So the technology would be a product that we have heard about. It's a relatively new company. In this case, it's DeepScribe. So we wanted to try something that was kind of in line with where the industry is going, but maybe something a little less expensive than some of the nuanced solutions that are out there today. Certainly a cost, especially as you're looking at proving out a concept. So where we were is we had an iPad, we had an application that our doc was launching, integration with the medical record, and being able to look at with what that progress note would be post interaction with the patient. So what we're finding with the evolution of the model has been removing the human from the technology side as kind of that intermediary. Now there's enough data to train that large language model to have that concise AI output that we're all looking for, that's going to drive that efficiency that really is populated in the medical record just about in real time.
Yeah, that's amazing. I mean, I know that physician and provider burnout is a big thing. The amount of time that they have to spend on administrative tasks can be overwhelming at times, especially you're always creating long hours to provide care. And then the amount of time that you have to spend, I think you and I were talking before, you called it pajama time, to go back and do all this administrative work. And I know this is one component of all the work that has to be done. You combine that with a shortage of physicians that are out there, and I think there's a spectacular way of applying technology to buy back more time to apply that towards care, reduce burnout. And I don't know that if you're sitting out there in the audience, I mean, this is a really big problem in the space. I'm really excited to see some of the stuff that you guys are doing and where you're going to push the boundaries. So this was in a pilot stage today. How do you think about scale, and are there any problems that you've already given thought to about how you take this from the pilot stage into something that can truly be scalable across the whole organization?
Absolutely. So I think about with where we start and with where that capability is in the future. So we want to make sure the technology works well, hence the pilot. We want to make sure we've got good provider adoption, which we do right now. And then the interest from the other providers, is this scalable? Could this replace a voice dictation solution in the future? I think there's certainly capability to do that. When we talk about some of those different use cases, and we're talking about documentation right now for the providers and the clinicians, it certainly isn't a one-size-fits-all approach. So when we think about the complexities of healthcare, we've got different environments that are different care settings, right? So we've got, I'm going in to see my doctor, I'm going into an exam room. I'm in, I'm out. That's one area. We've got inpatients. So at Mary Free Bed, we have medically complex patients, and our length of stay is much longer than what it is in acute care. So these are relationships that we're driving with the patients while they're really residing at Mary Free Bed, as we provide those therapy services and really working on those goals to regain as much function as possible to translate to what that next normal will be. So we've kind of embedded that into our operations too, but we talk about an inpatient room. It's a different care setting. So having an ambient solution in the palm of your hand, would that work in the hospital? Is the medical record templates, are they built that way to really satisfy some of those requirements? We don't know until we try it. So that's where I get excited, because we're really like pushing the envelope here. What else can we do with this technology, and where is this going? So I don't think the technology is really a limiting factor. I think it's the progression and the adoption of those solutions in these different environments. Another area that's really hot for me is our therapists. So we have a lot of therapists. I mean, we're providing physical therapy, occupational therapy, speech therapy in the hospital. There are requirements for our patients to receive those services every day. And then we've got outpatient therapy. So that would be more for exercise, things like that. For physical therapy, again, occupational therapy, speech therapy. So we're able to look at those environments where you're in an open gym area. So you might have 10, maybe 12, maybe 2 other people that are in that room at the same time. You've got a clinician who's working with the patient, but you're in an open area. So would an ambient AI solution work? Is it sophisticated enough for you to be able to use, like you've got your AirPods in there as
Sure.
a clinician, and being able to use an ambient solution that's just going to populate with what you want into the medical record, in the spirit of being in a room with a bunch of other people? So how do you embrace that too, and create a solution that works for multiple care setting environments, and have the concise output that you're looking for with the degree of accuracy that we want? We don't want to have something that's going to put documentation in the medical record that's erroneous, that we're going to have to spend more time going back through and really combing it and say, okay, this was not right. This picked up this, and this. I need to redo the whole note. So then you've kind of lost with what the whole goal was to begin with. But you try it to see with what's going to work. So again, in the hospital setting with our therapists, a lot of that's hands-on. So our patient populations, again, medically complex. We're working with spinal cord injuries. We're working with brain injuries, stroke patients. So those are some of our core diagnoses that we're seeing in the hospital. So you're requiring hands-on a lot. I mean, you're hands-on here with the patient. I'm not over here documenting on my computer unless I have my patient in the safe area that I can do that in. So
Sure.
If you're working with a patient, being able to pick out those keywords at key times and be able to populate that information into the medical record, that would be like the holy grail.
Yeah, that feels like, from a patient perspective, I'm not sure how others feel. Usually when people are heads down taking notes versus actually engaging and having a conversation, you always feel like you're wasting time, or not really having the time to have a more in-depth discussion. And then even any session that you might have with anyone, you never feel like you have enough time with the person to begin with, because they're trying to clock what they need to do for this session, all the other work that needs to be done, and then you're in and outs, and then on to the next person. Do you feel like scaling this solution is also going to give you a higher degree of almost hospitality in the way that you think about delivering care back to the patients themselves?
Yeah, I think you touched on it earlier with the physician burnout, just that level of satisfaction that we're looking for. It's hard to measure patient experience sometimes too. I mean, the patients that are coming in through our doors have already been through the wheels of the healthcare system, and we're one of those last legs of the journey to transition those people back to that next normal. So, any time that we're able to provide to those patients is going to be time well spent and appreciated. So we have a different relationship with our patients in some of the acute care hospitals, because again, our length of stay is going to be much longer than acute care. So we're really, something that we do at Mary Free Bed is, we'll celebrate the patient discharge to be a graduation. So it becomes a moment of celebration to transition you to that next care setting, or at home, is really with what we focus on. So anytime that we can gain for the providers, the clinicians, the nurses, everybody who's at the patient bedside, is time given back to serve more people.
Jason, this is just one of the many things that I know that you and your organization are giving thought to. Could you give us a little bit of a glimpse into, this is one pilot, we're attacking this one problem. How are you thinking about other ways that AI can make a difference at Mary Free Bed?
I love that question, because we can go so many different places with that. So,
I guess what are you most excited about that you are thinking about, where you guys, you and your organization want to push the boundary, even if it's aspirational? How are you thinking about what comes next?
I think that we embrace with what the realities are, the healthcare worker shortage, and how can we drive more efficiencies with technology solutions. Again, we want to use the tools in the tool belt to the best of their ability, but what else is out there? So when we think about the machine learning, the artificial intelligence, we have quite a few things that are in the hopper right now, some areas that we're really focused on and really moving the needle and, in the spirit of the people that we serve and in healthcare without boundaries. So we talk about destination healthcare a lot. What are some of those differentiators? But specifically for AI, we're looking at ways that we would be able to really automate with what some of the pain points we have today, whether that's through our knowledge workers, whether that's through our clinicians. We're really talking about some of the ambient solutions today, but what else is there? So if we know that data is really the core for machine learning and the artificial intelligence output, that's great. So how do we leverage those technologies in a way that we haven't before, because we have enough data? Do we trust the data? Well, if it's our data, we can trust it. We're not using an open engine that's pulling, from the internet different ways. This is more of in our data lake, our own walled garden that we have a level of autonomy over. So then partnering with different technology vendors and say, this is what we have. Here's a use case that we're thinking about. So just a thought here is, we're talking through this, predictive length of stay. So I'm a patient, I have this core diagnosis, I have these social determinants of health, and I have married that with the best outcomes that Mary Free Bed provides. Could we develop a model that would be a predictive analytics that say, yeah, upon admission, we predict your length of stay based on your outcomes to be 2 days less than the national average? That's kind of a compelling story to think about. And I think kind of spinning that off into some other areas, just as an example of a kind of a high level idea. If we were able to operationalize that, knowing that we're below the national average, we can walk that talk. Now we've got a good data set. We can talk to our payers. It also helps with our throughput and our drives our mission and our vision to serve as many people in the communities that we're in as we can.
Well, and if you're going to accomplish that in less time, I don't know anyone who says, I wish I could just spend, a few more days in the hospital if I could get the same results in a shorter period of time. So that sounds pretty amazing. Where do you go next? When you think about this pilot is going, you're going to work on scale. Do you have other pilots that you're about to kick off this year? Any glimpse that you can give to the audience of like how you guys are thinking about staying aggressive?
Yeah, I've got a project that we've been working on for quite some time that's getting some legs, and we're ready to take flight into the really exciting portion of more application development. That's something that we are working on ourselves. And I won't pull back the curtain too much because we're not there yet. But, as we're talking about that vision and that mission to serve as many people as possible, healthcare without boundaries, what we're looking at is developing a mechanism that would be screening for early detection for movement disorders. So it'd be something that would be scalable as a come to market product. That would be a solution that could be in clinicians and potentially even consumers' hands at some point in the future. So we put a lot of thought into this. We've been very methodical. This is channeling my best Steve Jobs would be, I just want to make a dent in the universe. This would be the ultimate give back to the communities and really provide tools. And I think the core value here is really thinking about the earlier the intervention, the better the outcome. So the earlier we know about this, the more treatment we can start sooner and reverse some of those effects or really negate those. And we provide a better quality of life for the people that have been impacted by said event. And we are happy to help them on that journey to recovery and to regain that function and whatever those goals are for those individuals that we serve in the communities that we're in.
That's so exciting to hear. It's I think every family out there has had different health issues that they've had to experience. And, thankfully, healthcare, our current degree of how we think about technology and how we're able to apply care is obviously doing amazing things. But it always makes you think about what could this be, especially if you watch, science fiction shows or you just wave a wand or the predictive nature of understanding what's exactly going wrong. There's so many variables in a human body. How do we get better about detecting what's happening? And why don't we know the answers to some of these questions? Or why can't my care be, just work like magic? And I feel like you and others are pushing the boundaries of just scratching the surface of how technology is going to radically change the way that we think about healthcare. And it's really exciting. If you're up for it, when you get closer to that solution, I would love to have you back for another episode to dig in a little bit deeper of what you guys are doing on the clinical side.
Yeah, happy to do that. There's tremendous opportunity out there. It's really exciting. The technology is not the limiting factor. It's how do we use these solutions safely and effectively as we develop our governance How do we look at this from a risk standpoint as well? As we go through cybersecurity, we go through our risk assessments for any of the solutions that are introduced into our environment. How's that data being used? It's a different question today than with what it was even a couple years ago. So if our data is being used into a solution, is that feeding machine learning? What is that output? What are the risks associated with that? So those are some questions that we didn't have to ask ourselves a few years ago, but certainly something that's really, really important, especially with the cybersecurity attacks that are on the rise.
Definitely.
Healthcare is a prime target for that. So that's probably a whole nother conversation for another time, but that's something that I think about all the time when I can come up to Rise for Air and look at the innovative aspects of what we can do and really be those change agents and push the limits and meeting with what the needs are based on a vision and a strategy. That certainly fuels the fire and gives me that passion to continue doing with what we do.
When you mentioned earlier about having your own data, being able to use that for different use cases, and you touched on risk management here, and I want to just double click on that for a second, because it is something that we're seeing across the country, is that the risk management aspect, even if you have the data that is necessary, is a major hurdle to overcome, to be able to safely use technology to do the things you want without unintended consequences or unintended access to different kinds of data or any bias that might be introduced, on and on and on. How have you and your organization thought about this data lake, data warehouse, lake house that you have today? And how are you preparing the organization to be able to pull off all these experiments that you want to be able to do with data and risk management in mind?
Well, the first was to have a conversation about with what the reality is, what we're facing. So we look at that from an internal perspective. I had the pleasure of meeting with our compliance officer last night and really fleshing out the final stages of an AI policy. So what started as a pain point from a policy perspective of we've got to wrap our arms around generative AI like right now. We've got to shut this down. Are we going to use it? Are we not going to use it? I'm like, let's talk about with what does make sense and how do we embrace what people are expecting in the spirit of those efficiencies. So what turned into a generative AI policy has really evolved into more of an AI governance structure that we're putting together right now. So policy in place, we're looking at having an artificial intelligence governance council to meet with what the needs are. Let's review with what some of the use cases we have today, pilots, other ideas. Let's develop some auditing mechanisms to know how many people are using some of these solutions today that are just open and on the web. That's a little bit of an area that we don't have control over, but we have not shut that down yet, as of right now anyway, to embrace with the creative spirit of the marketing teams and some of the other team members that are using some of these solutions today. So that's more organic and people are finding these on their own. People are pretty crafty. Our clinicians are super smart. So if they can develop a template that takes seconds rather than minutes, they're going to figure out a way to do that. So that was one of the other use cases. We're talking about AI. One of our providers is like, hey, I want to do a letter of medical necessity, and I use ChatGPT for that. I'm like, okay, let's talk a little bit more about that. I didn't want to take that solution away, but I'm like, okay, let's talk about how you're using this. Like, I can guarantee you I'm not putting any patient information in there. There's nothing, corporate that I'm putting in here. I just wanted a template. I said, okay, well, let's look at that. So he showed me with what he's doing, and he was able to take that information and put that into the medical record. But the key to that was, again, no proprietary information, no patient health information. And he validated with what the output was. His name's on that information that he's putting in the medical record. So that was another area of, let's just talk about some of this and really not having that friction between the clinicians and the IT teams, the risk and compliance. That's a fine balance that we work through every day. With our contract review that we have with different vendors that are being introduced to Mary Free Bed, we do a security risk assessment. Does it have PHI? Yeah, it does. So let's talk about how that data is being used. And, we're going to insist that we work together with said partner on a business associates agreement. So we know who's at risk for what and what those accountabilities are. So what we hear about is a lot of the material breach and the limits of liability, the third-party vendors. There's always a link in the chain that has exposure. We've seen a lot of those instances in healthcare. We're seeing them all the time, especially in our backyard here too, within the last year for sure. So again, embracing the reality. What have you learned along the way? Me conversating with colleagues, industry leaders. Trace3 has been a great partner for us, a great opportunity to kind of bounce some of these ideas off of as we develop our own governance structure. So that's been a gift to us to be able to reach out and say, we know with what we know, but what else is in the industry? How do we use these safely and effectively, but also with what is in line with industry? So some of the recommendations that were provided is, we develop a policy that's great. There's accountability behind it, but the evolution of technology, it changes. So this is not something I view as a static moment in time that's going to live for 1, 2, 3 years. This is something we're going to have to review in terms of AI right now, probably every 6 months, no more than a year that we can go without reviewing with what that policy is, what the use cases are, what we are adopting, what our development strategies are. And again, what else can pop up that we don't know about? How can we leverage our data in a way that we haven't been able to do before? So lots and lots of opportunities out there.
Well, I think it's smart that you're thinking about a flexible approach, because the space is literally changing every day. Every day I'm surprised by, the next wave of innovation, things that are happening out there, whether it's success stories or new startups who are doing something really cool and interesting. Jason, I know we're almost out of time. Any last words of advice for anyone out there who, things that you've learned through your own experimentation, through your own successful pilots, any final words of wisdom that you have for the audience?
Yeah, I think it's important to start small and build on those successes. And I think that is a way that we can develop kind of knowing with what works and what doesn't work, but not be afraid to be risk adverse. Now, we want to make the most informed business decisions, but we don't know with what we don't know. There's an ability to follow your instinct. But, kind of thinking about, let's challenge with what we've always done. And maybe it's time to reimagine with what we thought we knew to make tomorrow better than today.
Jason, thank you so much. Really well said. Appreciate you taking the time today to be on the show in your very busy schedule. Would love to have you back sometime to talk about, you get a little further into some of those clinical use cases you're talking about. In the meantime, thank you again for being on the show. It's been a true pleasure.
Yeah, thanks, Tony. Really appreciate it. Have a great afternoon.
You as well.
You've been listening to LiveAI. We hope you've enjoyed the conversation. This episode is sponsored by Trace3. To learn more about why you should connect with them about your enterprise practical AI use case, visit them at trace3.com or look for them on LinkedIn. Thanks for listening.